Welcome back to the final round. Let's get to the latest on coronavirus. The Wall Street Journal reporting that the White House has dropped its objections and has signed off on the FDA's guidelines for approving a coronavirus vaccine. For more on this, we want to bring in Dr. Eric Feigl-Ding. He's an epidemiologist and senior fellow at the Federation of American Scientists. And we also have Yahoo Finance's Anjali Kamlani joining the conversation. Doctor, it's great to have you on the show. With the White House signing off on the FDA's 2-month COVID-19 vaccine guideline, I guess my first question to you is, where does this put us on a likely timeline for a vaccine to be approved?
Well, the vaccine actual timeline hasn't changed. It's whether Trump would have previously had the gall and ability to overrule the FDA in approving it without the extra safety data. So if anything, this will actually make the trials reports and confidence more safe, because we will have the extra data to be sure that is efficacy works well enough and safe. And I think this is a good news all around. It just means that Trump would be unlikely to approve it before Election Day.
And Doctor, we talk about the fact that with this vaccine, so many Americans, we've seen survey after survey that they are hesitant about potentially taking a vaccine, that there's a lot of distrust out there. Do you think that this type of headline at least would help improve Americans and their trust for a potential vaccine?
Yeah, I think this is a really good move because 1/3 of Americans say they won't take it outright, 1/3 say they will, and 1/3 said we'll see. And this wait and see, and the huge number of people won't taking it is really worrisome, because a vaccine is only as good as how many people take it, right? A 100% effective vaccine is only 50% effective if half the people take it. And so I think this lays the seed that people can trust it, that when the results come out, the scientific community will get behind it, as opposed to panning that was too early and too risky. And that key messaging is one of those things where you will actually win the war in the long term against the coronavirus next year, whenever it rolls out in the general population.
Dr. Anjali here. I know that Dr. Peter Marks, who we all know is the FDA's top vaccine expert there, has been at various events and symposiums talking about this 2-month period, but also saying that they wish they had more time, spurring what I think is a letter from multiple health experts pushing for even more time. Not that the White House caved on the 2 months, any chance that we will just continue following science on this one, and is more than 2 months necessary?
Yeah, I think we will probably need longer. It depends. The timeline actually depends. A trial has enough data when actually enough people get sick, and you can actually have a contrast between the vaccine and the placebo group. But I think this is a good first start. Actually, the FDA posted it online against the White House wishes in one of their other side websites, which kind of forced their hands, because then the White House would have had to undermine the FDA publicly, very publicly. So in certain ways, what the FDA won this battle, it won it grudgingly. And hopefully there won't be any more of these kneecaps. But technically, Trump can still approve the vaccine over, because as of last month, they assumed all the approval powers from the FDA. So hopefully they will abide by this, and hopefully we'll have good data.
We've got China now looking to get some kind of assessment from the WHO to allow for the emergency use of some of their vaccine candidates. And I'm curious how significant you think any kind of assessment or approval from the WHO would be, especially given concerns about the way in which the trials have been conducted in China, the safety and efficacy questions. I mean, ultimately, is this really about trying to get the vaccine to more of the emerging and developing countries that are likely to be left out as some of the big names that we've been talking about?
Mm-hmm. Yeah, I think WHO, their vaccine consortium is the COVAX consortium with Gavi and the Danish group, that U.S. as a part of Warp Speed are completely separated from, because U.S. did not want to join them. WHO wants to make sure that the vaccines are safe and get into the hands of developing countries, and hence why they've developed and actually made pharma commit to actually reducing their profits and waiving their profits altogether. Meanwhile, the US warp speed vaccines have not. And that probably limits the availability of all these warp speed vaccines for developing countries in getting in their hands. So WHO cares about global health. Again, Trump cares about America first again. And that's not a good idea, because with all these different vaccines, their vaccines could actually be superior to ours. And now we're basically putting all our eggs in one basket, and that is risky.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.